Hi, everyone. Welcome back. This is Amanda Desosito, CEO of My Mountain Mover. And today, on today's episode of the Pinnacle podcast, we have Johanna Camacho with us from Access Healthcare. How are you, Johanna?
Hi, Amanda. I'm doing great. Thank you so much for asking. Honored to be a guest here.
Thank you so much. We are so excited to have you. You're our first medical client who is joining us on our podcast. So
I
it's a
saw, I
whole,
saw. So I'm setting the
yeah.
tone.
Exactly. It's a whole different ball game than real estate. So I'm just excited to chat with you today and just to hear a little bit more about your virtual assistants, how they're doing, especially in the healthcare industry. So why don't you introduce yourself? Tell us a little bit about you and your role that you play in Access, and then what Access Healthcare Associates is all about.
Yeah, absolutely. Thank you. Thank you for the warm intro, Amanda. Yes, my name is Joanna Camacho. I'm the practice manager with Access Healthcare Associates. I've been proudly serving our private medical practice since March of 2012. So just shy of 9 years. I've really had my pulse on the entire practice, from internal to external operations, on the front line with my team, just really helping to adapt processes in our medical practice and our culture. And that's kind of been my role. And I've been working with very, very closely with our founder and medical director. His name is Dr. Matthew Leckerman, and he is such a visionary. I can't speak so
Mhm.
highly of his vision and philosophies and everything that he incorporates to making Access Healthcare what it is today. And I think that's really important for us, is just that I'm aligned with his philosophy, and that together we are working tirelessly to build this unique model that we have. Um, so our medical practice offers quality medical care to seniors in their place of residence. So we are a private independent practice, but we focus on the Medicaid and the Medicare population. So we're committed to improving quality and scope of medical care to the elderly population. And that's really where Dr. Leckerman got his niche. So Access Healthcare was founded. He was a hospitalist, and
Hmm.
he comes from a hospital background, doing rounds there, and he saw a gap in the care from when a senior was hospitalized and then discharged back to the home, that there
Hmm.
was a gap in care. And that's really how we derived since 2007, when Access Healthcare was established. We now provide a broad scope of care, specializing to that geriatric population. So, house calls, post acute rehabilitation, wound care, palliative care, hospice care, chronic disease management. We really cater to all of those needs for seniors.
Hmm.
And our focus really, where our bread and butter is seeing patients in assisted livings, skilled nursing facilities, and boarding care facilities, as well as private homes. So we're essentially a concierge practice, is really how we consider ourselves. And we have been seeing the geriatric community in the greater Los Angeles area. And that's kind of in a nutshell of what we've done, who we are, and what we've
Yeah.
built.
Yeah, you guys kind of do it all, it sounds like. That's incredible. When did he start this?
So it was established in 2007.
Okay.
And he has a great story, great pictures, where it started from a little room in his home. And it's him in front of a computer, and those old school MacBooks, where he's just doing house calls. And that's really how it started. And now we're built to, we have two physicians, we have an entire panel of mid-levels, we have nursing staff, medical assistant and phlebotomy staff, and virtual staff.
That's incredible. Wow. What a cool story. Oh my gosh. So when he started, how did he get into this virtual assistant industry? Like, was that even on his radar when he started? What kind of sparked your guys' interest in adding virtual assistants into your practice?
Yeah, I would say that virtual assistance was first an idea that was introduced to us about 4 or 5 years ago.
Mm,
That's when we first learned about virtual associates and kind of what that concept really meant. And we're still continuously learning, especially in all fields of industry, is how can a virtual associate really assist in your organization, your company, in your industry? So we first dabbled into that, I would say, now going on 3 years.
mm,
Is we spent a couple years vetting with, is this something that would work? Does this make sense? It was just unknown territory to
mm,
have a VA or VMA at that time 5 years ago. So it
mm.
was about, I would say, in 2016, 2017, where we first entered into our first partnership with VAs and what that model looked like and incorporating that into our workflow.
Okay, wow. So 2016, 2017. What was that experience like when you kind of decided to pull the trigger and hire your first virtual assistant?
I was really nervous. I didn't know what to expect.
Yeah.
We really didn't know what to expect. I just knew that I was working tirelessly, long hours, 13, 14-hour days,
Mm,
constantly, and I was on a constant go. And we wanted to be able to deliver quality patient care and meet satisfaction goals, and we just weren't quite there yet. And when we first heard about virtual assistants and how they could provide quality nursing scope of practice help to the states team, we really didn't understand that concept and what it would mean. But I will say we had an excellent experience. We had professionals that were licensed nurses, fluent in English, and we were just a little bit floored that we didn't know this existed.
mm,
That this type of service was out there for providers and or for healthcare. You hear of when you call a cell phone company and you get, that offshore person. So
yeah.
that was always known, but in healthcare, it wasn't a thing. And
Yeah.
so, then trying it, we just really from there is when we just hit the ground running with VAs, and we started with one VA, and we built our team to today with MMM, my mountain movers, we have a panel of 15
Wow.
virtual associates. They actually have more virtual staff than what I call state staff, our state team.
Wow, that is incredible. Oh my gosh. So when you hired that first VA, what kind of job description did you give them? What were they responsible for?
Mhm. So we started off with two, very, just two. One was for medical records, just medical clerical work, billing and coding and filing, kind of that clinical administrative burden that most practice managers or most independent practices deal with. And
Mm,
then we also hired a clinical RN. And
mm,
both of them were registered nurses. So they understood that even if it's the clinical administrative the tasks, they were able to make that distinction that if this is an urgent document, they could triage that. And
mm,
triage is such an important skill that unfortunately that we lack. Even here in when you're interviewing process is just that critical thinking and that scope of practice and understanding the level of being able to triage certain situations. And
mm,
an RN understands that,
mm,
where a medical assistant they have not been trained. So that was really important to us. And we also had a clinical VA who was doing our day to day prescriptions, something as simple as prescription refills, prior authorization, and then them working directly under a medical assistant. And that's kind of how we first started. and
Mm.
just to see what would the experience be like, what would be the benefit, would it hinder us more to try and train them, or would
Mm.
it really prove as a long-term outcome? And well, 15 VAs later, we know how that ends.
Yeah, seriously. When they first started, how was that onboarding experience like? And when did you actually really start seeing like this is gonna work? Like they're doing their job. We're seeing that the patients are getting better care because of them. Like, was there kind of a breaking point during the onboarding process where it started to click for you and for them?
Mhm. Yeah. So for at that point, they made it really seamless process, in a sense of orienting them to our practice and what our needs were. We were a little bit smaller at that point, so we were able to have that one-on-one intimate training, with myself and with other clinical team members. And it just once I saw that my staff's burden was lifted. They were working less hours. I was working less hours. And we were able to produce more efficient results, meaning turnaround time for orders were happening more effectively. We increased our billing significantly. So
Mm.
once you start to see those numbers and that revenue jump, and for us, maintaining a healthy work and life balance, that's really important to us. To
Yeah.
Dr. Lefferman, for me as a practice manager, is knowing that my staff feel supported and heard and that I was able to meet their needs. That's kind of
Mm.
when we started to really make that shift and say, okay, well, what else can they do?
Yeah.
I don't think that there's anything that's not in their capacity.
Yeah.
And that I would say was really that kind of turning point where we felt confident that we were seeing results. The numbers don't lie. And we started to increase our virtual staff. And also, I would say is turnover. As practice manager, as office administrator, we struggle with turnover, and VAs are consistent. For
Mm.
the most part, it's just a different pool of candidates and team members that you get. They really understand, and they're really grateful and honored for to be in a medical practice and servicing a medical practice in the United States. And that to them, they work harder.
Mm.
And unfortunately, as a practice manager, is just turnover rates, unfortunately, with MAs, with CNAs or nurses, it can be very high. And
Mm.
this provided us a sense of stability.
Hmm. That's interesting that you say that because that has been my experience with our virtual assistants as well. Their work ethic is so unique, especially to our American culture. It's almost night and day, and you're right, I love that you touched on that because they do appreciate it so much, like, we're not only providing them with a stable job, but it's, providing them with a better life for their family, and they're able to stay at home. A lot of our virtual assistants are mothers, who are what this is an incredible opportunity for them to be able to stay home with their kids, and be able to work and provide income for their family as well as take care of their kids. So it's so true. I just love working with my people because it's unlike any experience I've ever had working with people in the US. So it's
E Exactly. It's very unique, and, when you really incorporate them into your company and into your culture, it flourishes so much more. They work so much harder. We work so much harder to continue to build, them up and to build their skills. It's really up to us to make them successful and to fully utilize them to their full capabilities.
yeah.
And they're our friends. I always tell them, like, you're a nurse, trust yourself. You have a bachelor's in science. Like, you got this.
Yeah, that is so cool. Um, One of the biggest things that I think is the struggle for healthcare providers to get around is the patient privacy and like cybersecurity issues with our VAs being in the Philippines. How did you guys address that? I mean, with 15 VAs now, is that a concern still, or how do you kind of combat that concern that most providers would have?
Yeah, and that's definitely that's one of the top questions, especially I remember my interview process and kind of in our discovery call, one of my top two questions was how will we protect patient privacy and make sure that that we're compliant with HIPAA regulations.
Mm,
And all of our operating systems are HIPAA compliant and cloud-based systems. Like from our internal communications, we personally use Ring Central, and then our EMR is Athena, and they are all software applications that are HIPAA compliant built in. So that initially is internally how we audit that as well. And I know that you at MMM have strict guidelines that you adhere to. You do HIPAA
yeah,
training, you require certification, um, and you know, and our internal IT department, they do a surveillance audit as well to ensure that to ensure our systems and our patient privacy is protected. So I think it's a joint effort, and it's really understanding what you're doing on your end as the third party vendors. Like, what measures have you implemented? What training has been exhausted and educated to that VA, and have experienced no issues. Our IT hasn't caught any cybersecurity breaches, and this is going on over 3 years of virtual associates in our practice.
yeah. That's great. It is something that providers are very concerned about, but I agree. I We have actually a whole slide presentation put together for our providers to show like we take this so seriously. And I think also with our world shifting to more virtual, because of the pandemic and everything, I think it's more important than ever. But I also think it's helped providers kind of understand that even if you have employees in the US, they still have to be, adhering by the same guidelines that our virtual assistants in the Philippines are abiding by, So I think it's kind of opened up this opportunity and then this discussion to say, you know what, even if they're in the Philippines working virtually or in the US working virtually, their guidelines are still the same. They still have to
It's
be
not
HIPAA compliant.
stricter.
Yeah.
Not stricter, I would say that I
Yeah.
honestly feel a little bit safer that hey, I have a third party that I'm outsourcing this and I'm trusting they're doing everything on their end, and you're implementing even more aggressive measures on your end to make sure that HIPAA and patient privacy is protected at all times. So it's definitely opened that channel a lot more.
Yeah, that's a good point. Um, so going from 2 VAs to now 15 VAs, I've been so impressed watching you guys onboard these VAs. I've never seen quite such an organized, systematic process for your VAs to really be like set up and be successful within the first month of joining your team. How did you guys do that? Like, explain that process to me because I'm sure there's providers who are interested, but they're like, I don't know how to train them. I don't have time to do that myself. How did that onboarding strategy even come about for you guys?
And this is actually one of my favorite stories to tell, especially with MMM. We onboarded 5 VAs simultaneously. And I can't attribute the success to just me. So, our director of clinical operations, Carrie Cudahy, who's our RN in the state, between her and I, we created a 3-week orientation and onboarding process for our VAs. And yeah, such a great success story. So we incorporated tools of Ring Central, virtual communication platforms, our different operating systems, and we had a fully outlined agenda that we sent them
Mhm.
out. So it really was just Carrie and I sitting down and saying this. are we either in this or we're not in this? Do we know what our goal is? And so
Mm,
we mapped out every single day with every single department that they needed to understand. And, we invested that one day in just to really creating this robust agenda and making sure that they understood our culture, our
mm,
company dynamic, and our patient population, because that's really what sets us apart is we're internal medicine and we deal with seniors, but we're not a clinic setting. And even that's even challenging to train on state's team or live staff, is that we have a real frail population and we're doing house calls. They don't come in the office. So, we wanted to make sure that we hit every single point that they had to understand to be successful in their role. And 2 months later, they're flourishing, and some of the stats that I will dive into a little bit later is the stats don't lie, and just putting
yeah,
in that one day that we did and that 3-week orientation, we understand they know our expectations, and then
mm,
we learn about them, and it helps us to focus on maybe one or two that is a little bit more challenged, and that, hey, maybe should benefit from more one-on-one time. So all of that incorporated together helped us to really just have a successful onboarding of 5 VAs. It's a great success story.
yeah. I have never seen such a smooth onboarding process. Like you said, not without its challenges, but I think what you guys did so well is you just committed from the very beginning, like you said, to be all in. And you kind of have to do that. You have to treat them like an employee, if you want to be able to get the most out of what they're capable of. Because you did have some VAs who were kind of lagging behind in certain tasks, or some, that were just excelling without any issues, but some, needed some hand-holding or needed some reassurance here and there, and but that was so amazing to see you guys just rally around them and offer them the support that they needed to really get them to be self-sufficient, which it was just incredible to see the process that you guys have put in, so
Thank
that's
you. And
amazing.
I would say also too, it helped to for us to identify certain leaders. So, there was two main VAs that stood out, and just seeing them collaborate and the team play, which we're all about, but seeing that remotely. So, Carrie and I are sometimes, maybe a meeting went a little bit longer. So seeing a VA step up in the group chat and be like, hey, on our agenda, we're supposed to follow A, B, and C. So how about let's get started and let's wait for one of our managers to be ready. So you can see that all transpiring in our group chat. So seeing how someone would say, "Oh, I know how to do that. Call me. Let's video share, and I'll show you." We could see all of that, and it was amazing. It's just like made it clear, like that's the type of team play that we want to orient ourselves to, and that they feel comfortable, and certain VAs could lead and develop those leadership skills so early, all in the first month. We were
Mhm.
able to just really dissect and discover that, and that was it was amazing.
That is so cool. For your VAs, how do you have them structured? What are kind of their job roles in your company? And then how do you have them structured within your system?
Yeah, absolutely. So we have a lot of different departments. Now with the help of MMM, we have them in our medical records department, in our clinical department, and billing. And
Mm,
so they operate directly under a department supervisor and other care team members, as we call them. So they are doing billing, coding, EMR data entry, prior authorization, insurance verification, prescription refills. But each specific VA has a job title and a job description. So that's
mm,
something that we do on the front end as well. We want them to make it clear these are your daily, weekly, monthly tasks, and this is what your main priority is. But we also explain to them in the onboarding process is that whenever you have downtime, cross train, because you're more valuable when you can cross train and help out. If you're in medical records, you can jump into billing department, and
Mm,
that. And I tell them that will only enhance their life skills and make them more professional in their careers. And so every VA has their department, their jobs, their tasks. And, as one offs come up, they're always willing to learn
mm,
and understand what we want to do and where we want to go.
yeah. That's so cool. Oh my gosh. I love that too. I teach my VAs to do that, my support staff as well. It's true. The more value that you can bring, the less indispensable you are to that business, you know? So why would you not want to try to learn another skill and add value, like you said, to your life skills and also to the company that you're working for? That's so cool. Okay, let's dive a little bit into stats. I know you kind of mentioned it earlier. So tell me a little bit about what these VAs have been able to accomplish for you. I know it's been a little bit of a short time period, but just in these past 3 months that you've been with us, where have you seen them really shine?
Yeah, and as I can go on and on with what they brought to our team and to our practice and our providers. But like I said, I'm also a numbers girl, and I look at the numbers and I look at the data, and that really speaks volumes for itself.
Mm,
So Ring Central is our communication platform. It's what we use for incoming calls, faxes, voicemails. That's our HIPAA compliant monitoring system. And based off of our Ring Central analytical report for the past 3 months, our call volume has decreased by 21.12%
wow.
as an organization. So to kind of put that in perspective, we were receiving about 1,800 calls a month,
Mm,
which is roughly averaging to about 90 calls a day, business days. And a lot of this was because we didn't have the manpower to be able to clear out these faxes, to update these medication refills, to carry out orders.
mm,
But with adding 5 VAs, that call volume a month now is 1,300.
wow.
So the average calls that we get a day are 60.
Wow.
That speaks for itself.
Yeah, that's great. That's awesome. Okay, what about days document open?
Yeah, and that kind of leads to our what we call DDO. So it's our days document open. So we use Athena as our EMR system, and they have a really robust reporting system and metric system to help us benchmark for our practices. We have to meet a certain criteria for MIPS data attestation at the end of the year. So we're
Mm,
looking at all of these different variables as a practice manager, as an office administrator. This is something that we look at.
mm,
And our practice benchmark is to have our documents or our faxes. So essentially, it's incoming faxes that are coming in. And for us, what that means is incident reports. Since we work with residential care facilities, it means that there's an assisted living that faxed us an incident report. So, patient had a fall, patient needs a medication, patients requesting an appointment. These are all different examples of faxes that we get. And our goal turnaround time is 2 days to have that document kind of inputted, processed, and filed. And in
mm,
September, prior to MMM, it was at 2.17.
mm.
And in October is when we implemented our 5 VAs, and that dropped to 2.10. November, we're at 1.85. So
Wow.
we are not only getting these faxes, but we're returning them same day.
Wow.
And that what does that lead to? That leads to our 21.12% call decrease because
Mm,
we're able to turn around these documents, these faxes, these orders, referrals in about a one business day. They're
wow.
not calling, they're not following up. So they've completely, transformed what we're doing and just really enhanced it, I would say.
Mhm.
It's just now we're able to really just be successful and focus on our patient care.
Mm, wow, and I'm sure the patients appreciate that so much too,
Yeah.
that it's such a
Absolutely.
fast turnaround.
Yes, and assisted livings. I mean, that's really our niche. Is just that we're considerably a concierge practice to residential care facilities or
Mm,
assisted livings. So being able to deliver to them is why we're in business and why we continue to be in business.
yeah, yeah, and I'm sure it's so crucial more now more than ever before, I'm sure. Wow. Okay, and then what about your 2020 practice benchmark?
Yes. So in 2019, we had our practice wide Q4 meeting, and at this point, we didn't have the amount of VAs that we had. So we had providers and we had VAs that were assisting multiple providers. So, based off of feedback from our providers, from our field staff, from our current VAs, we wanted to incorporate a model where we could be able to be at a point where every provider had their own
Mm,
VA, and that it just wasn't something, even as of last year, where could we afford that? Would it be beneficial? Like, how would it really impact that provider and impact our business? Because some of our mid levels are part time, so we didn't really know, did that logistically make sense for us?
mm,
Um, and with us now incorporating this model, physician burnout is always a concern, especially for independent practices. That's always on our radar. And according to Medscape's 2020 physician burnout report, internal medicine is one of the top specialties over the past 5 years to report on physician burnout.
wow.
Yeah, and so the leading cause of this is administrative burden.
Hmm,
So I was really looking into that, and 55% of physicians report that they attribute that to their burnout. Tasks as charting, paperwork, all things that VAs can do. So essentially, we wanted to create that dynamic where they felt like they had a scribe with them. And, based off of our feedback from our providers, one of our physicians, associate physicians, is Dr. Marotra. It's been just 2 months that he's had his VA working with him. And he says, it feels like I have a scribe with me during my visits. It's amazing. By the time I drive back home, all my notes and orders are carried out. I only have to spend 5 to 8 minutes, providers, if you're listening, 5 to 8 minutes on charting. uh, and
that's incredible.
Yeah, so they feel they're not here, but they feel like they're here. It's
Mm,
They feel that presence, and for our model, what that kind of means is our physician is on site. So they're on site, they're seeing the patient, and in the back end, the VA is transcribing all of that into their note. So
mm,
if our provider is dictating their HPI, their history of present illness, into the our EMR system, Athena, in live time, our VA can see what that provider has dictated into that encounter.
mm,
So the provider is having a visit and sees a patient has a cough, no over-the-counter meds, going to prescribe Robitussin, chest X-ray to rule out pneumonia. The provider is dictating that, and then by the time the provider sees the next patient, all of those orders are inputted. The chest X-rays out in the background. It's been faxed out. They'll probably get seen either the same day or the next day. That medication's called into the pharmacy. They're probably going to get it that same day, and the next patient, we're on to the next patient. So by the time the practitioner gets home from their field day, goes in to complete their charting, they're just pretty much checking off, does everything match? Did I miss anything? All the orders are carried out. we eliminate that burden for them where they're having to add that in, having to, add the coding.
Mm.
Our VAs also have been trained on coding. So we have certain quotas, certain protocols, and they stick to those protocols, they follow them, and they add the coding for our providers. So they're pretty much doing from front to end the entire encounter process. It's transformative for physicians, for providers. Um, it's yeah, it's
That's what I was gonna say. It's like life-changing for them to be able to not have to worry about that, and I remember my mom, like I told you earlier, she's an RN, she worked in hospice, and after a full day out in the field, she would get home and spend, like, 45 hours minimum just charting. And I totally see how the burnout would affect so many physicians because that is so much work. And you're completely right that a virtual assistant could handle so that you only have to go in and just check and make sure that the all the information is correct and accurate into your standards. So that is just it's so cool that you guys are already starting to implement this because it's something that I feel like physicians just aren't aware of, and that we just are trying to get that word out to them, that you don't have to live like this anymore, you can
there is a solution. There is
Yeah.
a solution, yes. And I think, for it's common for providers, it's just like, is can an can an offshore RN really understand the complexity of my patient? And the answer is yes. Why? Because they're not medical assistants. They
Mm,
have a higher level of training. They're
mm,
RNs, so they understand medication management, triage. That was one of the most important things that I really drilled is, triaging skills, is being able to help providers identify a situation before they see the patient, to help them
mm,
really focus on the chronic condition. And that's all within their scope of practice.
mm.
That's, they have hospital setting backgrounds and backgrounds in clinical settings, and they're putting all of those skills to use for your patients, for
Yeah.
your clinic, for your dynamic. So they're more than capable of managing those chronic diseases and medications.
It's incredible. It's incredible when you put it like that. Just to wrap it up, Johanna, I just thank you so much for being a guest on our podcast. Just two final thoughts that I have. Where do you see virtual assistants heading in the healthcare industry? Where do you see them making the most impact in this industry? And would you recommend this service to other healthcare providers?
Yeah, well, healthcare is one of the major success stories of our time, right? Medical science is improving rapidly, from like policy to patients, everything in between. The healthcare industry is constantly evolving. From aging populations, technological advancements, illness trends are all impacting where healthcare is headed. Practice as a practice manager, it's really crucial to pay attention to the shifts in society, especially in patient engagement. And, understanding that. And VAs are changing the care delivery equation completely. They
Mm,
have the potential to transform how healthcare is delivered.
mm,
They improve clinical workflows by increasing work efficiency, and they help improve the experience of healthcare providers,
mm,
allowing the healthcare provider to spend more time in direct patient care and
mm,
reducing burnout. And as an internal medicine private practice, that's consistently our goal.
mm.
So VAs are revolutionary.
That is so amazing, and I'm so glad that you touched on this. It sounds like it's a resounding yes, that you would recommend this service.
I would recommend it. And if by now, when they're listening to this podcast, if your doors aren't being torn down and your calls aren't being off the roof, I wouldn't understand it. Uh,
Yeah.
it's you have to be committed to try. I would say
Mm,
is just that it's just a whole different experience that you get with a virtual associate. They are professional. They are knowledgeable. They're clinically savvy, and they're ready to serve.
mhm,
They're ready to serve, and they just will completely change your organization. They have to us, and I think it's just important to just also say is that you need to be willing to incorporate them into your culture and what you're building, and to make sure that they're a part of your team. I know that that's how we strive for our VAs. We're meeting with them regularly. We really let them know that changes that they're helping to impact and that we value them. And if they feel valued, they will work harder, and they do work harder, and they want to be a part of that change, and they want to help you to be focused on seeing patients and increasing revenue,
mm.
and we all win.
Yeah, yeah. I couldn't have said it better myself, Johanna. So thank you so much for taking the time to be on our podcast. I really, really appreciate it. And for anyone out there who's in the healthcare industry, please let us know if we can be of any assistance. Like Johanna said, we promise it will really, really be beneficial to your practice and also to your burnout. So thank you so much for being with us, Johanna.
My pleasure. Thank you so much for having me again. And yes, definitely they won't regret it. And I love our MMM team.
Awesome. Well, thank you so much.